Hi, everyone. I'm Kim Straker, and I want to welcome you to our HR Forum event today, addressing return to work updates. I'd like to introduce you to my two colleagues, Bill Varade and Lynn Abdullah, who will be leading our discussion today. Bill will be kicking it off by updating you on New York reopening and the New York HERO Act. Then Lynn will discuss screening and safety protocols, as well as issues surrounding tracking and incentivizing employee vaccination. She'll then turn it back to Bill to discuss the latest on travel restrictions and reasonable accommodations. Last, Lynn will conclude with a discussion of reimbursement of business expenses. We have a PowerPoint that we've prepared to help you follow along during our discussion, and we'll be emailing you a copy of the PowerPoint after the event, so don't feel like you have to take notes on everything. To ensure that we cover all of these topics during our scheduled hour, we're going to answer questions toward the end of the hour. However, throughout the discussion, please feel free to put any questions in the chat box. I'll be monitoring the chat box, and we'll try to address as many questions as we can. If we're unable to answer all of your questions, then we'll follow up with you after the event. You can also feel free to reach out by email or phone after the event to any one of the three of us with your questions. We also wanted to let you know that we're recording this event so that we can send the recording out to those clients who weren't able to attend today. I'll be announcing the CLE code later for those of you who would like CLE credit. And with that, I'll turn it over to Bill to begin. Thanks.
Hey, Kim, thanks so much and welcome everyone. I'm going to do a brief overview of New York reopening. So Dave, if you could please go to the next slide. So on June 15th, 2021, New York reached a great milestone. After almost 18 months in this pandemic, we reached 70% vaccination rate, or 70% of individuals who had at least one dose of the vaccine. And at that point, all COVID restrictions were lifted. This included the industry-specific guidance that was promulgated by the New York State Department of Labor and Department of Health, including the executive orders. However, there were a few caveats. There are still restrictions regarding large indoor gatherings. Those are defined as having 5,000 or more individuals. Those restrictions are largely around requiring proof of a negative COVID test or proof of vaccination for those attendees. And there's also still industry-specific guidance regarding schools, pre-K through grade 12, public transit, nursing homes, healthcare settings, and correctional facilities are still subject to some restrictions. Although most industries now are following what New York has adopted as the CDC's guidance, specifically the guidance regarding both vaccinated and unvaccinated individuals. Now, the CDC for vaccinated individuals has removed almost all restrictions. So vaccinated individuals can engage in most life activities without having to worry about masking or social distancing. However, the CDC does still recommend, and again, New York State has adopted this guidance, that unvaccinated individuals still abide by many of the precautions that were previously in place, such as masking, social distancing, frequent hand washing, and the like. Now, one important thing is that it's really on the employers to establish the expectations for employees and customers. Dave, if you could go on to the next slide. Because even though mandatory restrictions had been lifted in New York State, so businesses can kind of take a step back and say, we don't have any restrictions, private businesses can still enforce some of the prior restrictions. Private businesses frequently, I'm sure as you see when you go out, still require masks. They ask that folks still social distance. We always see those little stickers on the ground for 6 feet. And they can also still enforce occupancy limits. So really, employers should be proactive about, letting both their employees and customers know, what is the guidance that we're following? What are the restrictions that we'd like to enforce in our business at our work site? Another thing that we've seen is that employees, regardless of their vaccination status, may still feel more comfortable wearing masks. I know personally, even though I'm vaccinated, whenever I go to the grocery store or another large, indoor area, I'm typically masking still. And, even when I'm going into smaller coffee shops or other businesses, we see employees with masks and unmasked. Now, employers, we feel that the best recommendation, the best course of action is to still allow employees the choice of masking, just with the caveat that, if it's known or if an employee has not provided proof of vaccination, the employers really should encourage and mandate even that unvaccinated individuals still continue to mask and social distance in the workplace. Now, of course, with any restrictions that you're going to apply to your workplace, you just want to be cognizant of anti-discrimination laws, particularly religious discrimination, disability discrimination, because the New York State human rights law has many protected statuses, some of which, would require or would not be able to comply with some of the restrictions when it comes to masking or mandatory vaccination, which we'll address a little bit later in the presentation. Now, even though New York has lifted its guidance, has moved on to adopt the CDC guidance for vaccinated and unvaccinated individuals, New York has taken some precautionary measures and has enacted the New York HERO Act. Dave, if you could go to the next slide, please. And we can go to the next slide. Now, the New York HERO Act is somewhat of a recognition of our evolution of the understanding of COVID-19 and what, how airborne infectious diseases are transmitted. Governor Cuomo signed this into law on May 5th, and then it was amended on June 14th, 2021. And what the law is aimed at is to combat the spread of airborne infectious diseases in the workplace. And what it does is it requires employers to adopt workplace safety standards. Now, this applies to employers of all size. The law does not contain any measure or account of an employee threshold. So no matter how few individuals or how many individuals you employ, the law will apply to you. And further, under the Act, employees defined incredibly broadly. As you can see by some of the examples, independent contractors are included under the definition of employees, part-time, domestic workers, home health and personal care workers, seasonal workers. It even covers workers that perform work on digital platforms and applications. So the reach of employee under the law is much broader, and this will be important for some of the rights that employees can exercise under the law that we'll discuss later. Dave, if you could please go to the next slide. Now, like I said, the law is going to require employers to either adopt or establish their own workplace safety standards with the goal of combating the spread of airborne infectious diseases in the workplace. Now, of course, you can't adopt nothing, so the law also requires that the New York State Department of Labor publish model standards. Now, the New York State Department of Labor, as we've seen in the pandemic, some industries were under stricter requirements than others, and that was just a recognition that some industries had closer contact where it was more conducive to the spread. Maybe that's not the best word, but more likely that the spread of airborne infectious diseases occurred in the workplace. So the New York State Department of Labor published both general standards and industry-specific standards. And these standards shouldn't come as a surprise to anybody. Many of the items that are under the standards have applied to employee health screenings, face coverings, personal protective equipment, social distancing, and cleaning and disinfecting protocols. Things that we have started to do and adopted into many of our common practices, again, as our understanding of how COVID-19 has spread and other airborne infectious diseases spread has evolved over the course of the last 18 months of the pandemic. Now, the model standards were published by the New York State Department of Labor on July 6, 2021. Dave, if you can go to the next slide, please. And this triggered the first employer requirement that we're going to talk about today. Now, employers have 30 days from the date that the Department of Labor published those standards to either adopt the model standards published on the New York State Department of Labor website, or to establish their own standards that meet or exceed the New York State Department of Labor standards. So again, these standards were published on July 6, 2021. So employers have until August 5th, 2021 to either establish or adopt those standards. Now, we're going to provide a link in the slides a little bit later, but the standards are not short. They're about 10 pages long. So this is a process that, if you haven't already started, you really should take a look at the standards, because this is going to take input from a lot of different decision makers, and this isn't going to be something that is going to be able to be put together very quickly. Now, one important caveat is that the employers only need to adopt or establish standards at this point. They don't actually have to implement the standards. So what do I mean by that? Like I said earlier, the guidance and the restrictions on employers has mostly been lifted, except for the few businesses that I mentioned in that first slide. So what employers need to do by August 5th, 2021 is to have a written plan in place. What they don't need to do is act on that plan. So what I mean, for instance, is if your plan has certain methods of increasing ventilation, of putting up plastic dividers or requiring social distancing, even though those are still good practices that we would recommend continuing at this point, especially with some of the variants that we're hearing about coming around, and that the pandemic is not quite over yet, and we haven't reached that critical mass of vaccinated employees. Employers don't actually have to do those things as long as their plan addresses all of the requirements of the standards. Dave, if you could go to the next slides, please. Now, again, there are industry-specific guidance, and this covers many of the industries that we've seen that were under stricter restrictions during the pandemic. There's 11 here that I've listed, and what you'll be able to see that the Department of Labor has published specific standards for each one of these on its website with the link that we've provided. One note I wanted to make is that office-based work was previously under stricter guidance, and the New York State Department of Labor did not publish industry-specific guidance for office-based work. So for office-based workers, you would be able to adopt the model standards or establish your own similar standards that at least meet those minimum requirements. And of course, we've included a link to the model prevention plan on the slides that will be circulating later. Dave, if you could please go to the next slide. The next requirement we want to highlight for employers is the notice requirement. So 60 days after the Department of Labor publishes standards, employers must provide standards to their employees. So this is by September 4th, 2021. This could be the model standards or the standards that you establish on your own as long as they meet those minimum requirements. And then going forward, the standards will have to be provided to employees upon hire. Now, employers are also required to post the standards conspicuously in the workplace. This would be similar to where your OSHA posters and other minimum wage requirement posters should be posted in the workplace. However, if the employer provides a handbook, in this case, the standards must also be included in the handbook. So our recommendation at this point is that, generally, folks are not updating their handbooks in the middle of the year. We think that an addendum to the handbook would be fine at this point, with the purpose of integrating those standards later when you do update your handbook. Next slide, please. Now, employees are given several rights under the Act, which is why I stress that the definition of who an employee is quite broad. So employees will have to be aware of what acts employees may engage in, what rights they have under the Act, as well as the prohibited acts by employers when employees engage in such acts. So, for instance, employees can report violations of the prevention plan to state and local governments or officials. They can report any exposure concerns to an airborne infectious disease, either to their employer or state or local officials. And they can also refuse to work if they reasonably believe in good faith that the work environment either poses a threat to themselves, to other employees, or to the public of an unreasonable exposure to an airborne infectious disease. And of course, employers, their agents, or anyone acting on behalf of the employer cannot threaten, retaliate against, or take any adverse action against an employee who exercises the rights under this Act. And that's important. Dave, if you could please go to the next slide. Because of course, the Act contains penalties for violations. The first one we want to highlight is that, with this August 5th deadline rapidly approaching, there's a $50 per day penalty for a failure to adopt or establish a prevention plan. And that penalty can be assessed by the New York State Department of Labor. Further, If the Department of Labor finds that there has been a failure to comply with an employer's plan, there'll be fines ranging from anywhere from $1,000 to $10,000. So these penalties are not insignificant, which is why we stress the importance of starting, if you've not already, to work on your prevention plan. And next, the Act also provides a private right of action for individuals. And this is unique because the individuals can sue for injunctive relief if an employer fails to comply with the Act. And of course, it contains fee shifting provision, so which can encourage attorneys to take up such work, because a successful plaintiff can be awarded attorney's fees and costs. However, there were amendments that were made, so at least that there is a notice and cure period for employers. So before an employee can pursue any such action against an employer, the employer has to be given 30 days notice and time to cure any such non-compliance with the Act. And the only way that an employee can get around that 30-day cure period would be if they can demonstrate an unwillingness to cure a violation in bad faith by the employer. Now, also, employers do have some protection in this regard if they face frivolous suits. If the employee suggests that the employer wasn't following the plan, but hasn't, it's totally unrealistic that they weren't. It does allow for fee shifting so that employers could recover fees and costs for having to defend against such a frivolous suit. Next slide, please, Dave. The final piece that we wanted to highlight under the New York HERO Act is the Joint Labor Management Workplace Safety Committees that the Act will require. Now, this is going to begin on November 1st, 2021, and there is an employer size threshold here. So employers with 10 or more employees must allow the formation of such joint labor and management committees. Now, these committees are going to be comprised mostly of non-supervisory employees, 2/3 of the committee, and they're selected by non-supervisory employees. Now, the Department of Labor hasn't suggested how those employees will be selected. We would expect that it would be some sort of election process. We also expect that since the November 1st deadline is a little bit away, that there will be further guidance that the New York State Department of Labor will provide in regards to this area. Now, as the Act was originally written, it was incredibly broad, and these workplace committees could touch on almost any aspect, any policy of the employer. However, with the June 14th amendments, these have fortunately been narrowed so that these joint labor management committees will only be partaking in various work and health place safety issues. So that includes reviewing policies of the employer that are related to workplace health and safety, and also engaging in government audits. Whenever the government comes, if there's a workplace and safety audit of the workplace committee is allowed to take part in such government audits. But again, this is narrowed only to workplace health and safety issues. Further, these committees will be allowed to meet at least once a quarter, and the members of the committee are allowed to obtain trainings, and all of that has to be on the clock. And the Act lists 3 specific trainings that the employees will be allowed to attend. Dave, next slide, please. So what's our practical advice? Even though the Commissioner of Health has not said, as I said earlier, that there's no highly infectious, contagious disease that's presenting a threat to public harm right now, in other words, that COVID is not seen as such a threat that employers need to implement these plans, we still recommend continuing to take precautionary measures that you've already been doing: the health screenings, disinfecting, social distancing as best as possible, hosting meetings and gatherings in larger spaces than maybe you traditionally have, just because we think that the preventative measures, despite not being required, is still the best practice. And then, of course, any preventative measures that you do take will depend on your specific industry and your work site. But we'll go to the next slide, please. I'm going to pass it over to Lynn, who's going to speak a little bit more about some of the screening and safety protocols.
Great, thanks, Bill. Dave, next slide, please. Okay, so New York for COVID-19 guidance is now optional. So on June 8th, New York State issued updated interim guidance for office-based work during COVID-19. And this update laid out various required safety and screening protocols for all employers with in-office operations. But as Bill just mentioned, as a result of the state reaching the milestone of having 70% of all adults receiving at least one dose of the vaccine, Governor Cuomo announced that all of this guidance would be lifted as of June 15th. So now all this guidance, it's now considered to be archived and it is just optional. So the only required safety protocol that employers and employees must still adhere to is that unvaccinated individuals must continue to wear masks in accordance with the federal CDC guidance. Still, it's recommended by both the state and the CDC that employers continue to follow the guidance even though it's no longer mandatory. So we will briefly cover some of the most important updates to the archived guidance, beginning with daily screening. Next slide, please. Okay, so daily completion of health screening questionnaires is no longer required of employers. Employers are still encouraged to continue to screen individuals entering the office by posting signs, administering a survey, or by telephone or mail, or any other similar means. Individuals, we recommend, should continue to be screened out if, one, they are currently experiencing or recently experienced in the last 48 hours any new or worsening COVID symptoms. Two, if they had close contact or proximate contact as defined by the health department in the past 10 days with any person confirmed or suspected to have had COVID. Or three, they tested positive through a diagnostic test for COVID in the past 10 days. And so when we say close contact, we mean being within 6 feet for at least 10 minutes over a 24-hour period. These recommendations for screening out people are considerably relaxed compared to the previously required screening. So for example, now screening out fully vaccinated people, that is people who are 14 days out from their second vaccine dose, due to close contact is no longer recommended. So we still recommend that employers have all employees, including those who are vaccinated, complete the screening, however they choose to administer that. But a vaccinated person does not necessarily need to be kept out of the office just because of close contact. Instead, these individuals can just watch for symptoms for 14 days following the exposure. And the same goes for people who have fully recovered from a lab-confirmed diagnosis of COVID-19 within the past 3 months. A couple of important considerations relating to the screening of employees. So first, employers should encourage employees to let them know immediately if there's a change to their screening answers. So for example, if they learn after the fact that they have had close contact with someone who tested positive, or if they begin experiencing symptoms, they should have a mechanism to inform their employer of this change. And second, employers should be careful not to keep records of any specific health data. So instead, we encourage them to keep records that just confirm that the screening itself happened and the result of that screening. So for example, it could be noted that an individual was screened for their temperature and they did not have a fever, but it should not be noted, for example, that the person had a 99.9 degree temperature. Next slide, please. So safety protocols. As Bill mentioned, offices for the most part are permitted to reopen at full capacity with very limited exceptions. And although vaccinated people no longer need to wear masks or keep distance from people inside the office, unvaccinated people must continue to do so under the law. Employers should continue to clean and disinfect areas as a best practice, and it's recommended that employers generally continue to follow health and safety guidance, included the bulleted list of items that are on the slide. So distancing when possible, limiting shared spaces, taking care to hold meetings in open, distance, well-ventilated areas whenever possible, and posting signs to continue to remind employees that the pandemic is ongoing and that everyone needs to continue to play their part in promoting the health and safety of themselves and others in the workplace. So another thing that Bill touched on just a few minutes ago, another thing that employers may want to do is communicate with their employees that masks and face coverings are still a great way to protect themselves and others, regardless of vaccination status. And this is especially true with all of these new variants. So just because a person chooses to wear a mask in the office does not mean that they are unvaccinated, and employees should not be asking each other why they are or are not wearing masks, why they did or did not receive the vaccine, or any type of similar question. And so this type of communication from the employer reminding the employees of this should help them, regardless of vaccination, underlying condition, or disability status, feel comfortable with whatever it is that they want to do in terms of face covering. So employers have a lot of discretion, as Bill mentioned, in continuing to require and maintain COVID-19 related safety protocols. The key is to ensure that you comply with what is at least required as before. Next slide, please. So employers should have a plan in place for tracing and tracking cases of COVID in the workplace. At the very least, employers should have a plan for confirming the positive case and its timing, for isolating and disinfecting affected areas, tracing and alerting others who would have come into contact with that person in the 48-hour period prior to symptom onset, and contacting the state and local health departments. Employers in doing this should also take care not to compromise the privacy and confidentiality of the affected person. So employers should never reveal the identity of a person confirmed to have had COVID without explicit written permission, and just generally, this is not something we recommend that employers do anyways. Employers should also have return to work plans in place for where quarantine or isolation by an employee might be necessary. So just as a reminder, quarantine means staying at home and being separate from others if you are exposed to someone who had COVID-19. And isolation means doing the same if you test positive for COVID or if you're experiencing COVID symptoms. So regarding quarantine, if an unvaccinated person had close or proximate contact with someone with COVID, they must quarantine for 10 days if they are themselves experiencing symptoms, or if they're asymptomatic for 14 days. In the case of a vaccinated person, there's no quarantine necessary if that person is asymptomatic. But if they do experience symptoms, even vaccinated people must quarantine for 10 days. Regarding isolation, regardless of vaccination status, an employee must isolate for 10 days from the date of the onset of symptoms, or if we experience no symptoms, 10 days from the date of their first positive test. Next slide, please. So tracking and incentivizing vaccination. Although employers can mandate vaccines, what we are seeing more frequently is strong encouragement, sometimes in the form of an incentive program instead. And the decision to have a mandatory program, an incentive program, or no vaccination program at all will depend heavily on the specific circumstances of an employer's workplace, the workforce, the vaccination rate of the surrounding areas, and the nature of the work, and a multitude of other factors. But for many employers, we do recommend going the incentive route. Next slide, please. So when implementing or putting in place any sort of vaccination program, we encourage employers to require employees to provide proof of vaccination. And so some methods of proof that we think are acceptable are copies of the official COVID-19 vaccination record card that you receive at the vaccination site, or a letter from a doctor with the date and type of the vaccine received. Both of these options are in line with CDC guidance, and so they're fully acceptable in any sort of context. Another potential option is to consider accepting the New York Excelsior Pass. And if you don't know what that is, this is a mobile app that was created by New York State, and it functions sort of like a boarding pass app. So it's supposed to securely and accurately record vaccination status, as well as the person's recent COVID test results. And some businesses in the state have been using this app to restrict patrons and visitors or to permit them based on vaccination status. Importantly, what we don't recommend here, although some employers do choose this route, is to forego actual proof of vaccination altogether for something like an honor system. Frankly, authorities like OSHA likely will not be persuaded by this type of a policy if, worst case scenario, there ends up being an outbreak in the workplace. And it's important to keep in mind that although we are seeing positivity rates and COVID-related deaths decreasing, this is still a matter of health and safety. In terms of record keeping for this proof of vaccination, we recommend that a central system be put in place to track all vaccination records as well as any other relevant information. For example, if a person has been granted an accommodation. A specific individual or department should ensure that all unvaccinated employees continue to follow safety protocols as necessary, and having a central database of vaccination, of proof of vaccination will be helpful in doing this. And so employers should consider developing a paper or electronic form to be able to collect and maintain this information. And then along the same lines, employers should also develop a complaints process so that the same responsible person or department can track any complaints or concerns by other employees about potential violations of safety protocols, or if they have any sort of other concerns. Next slide. Okay, so the incentive program itself. Employers have a lot of discretion in providing incentives for employees to choose to be vaccinated. Some examples are to offer comp time or another form of paid time off or a monetary stipend. So best practices for an incentive program, the ones we have here and the ones that I'll be discussing briefly, these are meant to balance safety, liability exposure, and the goal of actually succeeding in encouraging a greater number of employees to get vaccinated. So we recommend that an employer should not provide the vaccine themselves or contract with a third party to provide the vaccine on their behalf. This way, employers can avoid compliance or liability issues relating to so-called employer-sponsored wellness programs under both the ADA or the Genetic Information Non-Discrimination Act. And instead, as just discussed, employers should require written proof of vaccination that was not provided by them. So the EEOC has confirmed that asking for proof of vaccination is permissible and it is not a disability-related inquiry under the ADA. But still, employers should not inquire into an employee's health or medical record beyond requesting proof of vaccination. And to that end, they should warn employees against revealing their own medical information when submitting proof. So these types of questions, for example, why did you get vaccinated? What's your underlying condition? Are you immunosuppressed? Those types of questions do still run the risk of implicating the ADA. Employers should also consider developing an accommodation plan or an alternative requirement to vaccination, and this would be to avoid implicating the ADA or Title VII. And so both of these laws require accommodation upon request for employees with disabilities and sincerely held religious beliefs absent undue hardship on the employer. So this means that employers who have an incentive program are required under the law to make accommodations for employees who request them if they can't earn the vaccination incentive due to their disability or sincerely held religious beliefs, and one of the two or both prevents this person from getting the vaccine at all. So this might mean developing an alternative requirement to getting the vaccine, such as wearing a mask all the time or getting weekly COVID tests and reporting them to the employer so that the person with the disability or religious objection can earn the incentive in other ways. Another potential option would also be to simply provide the incentive to employees who have a qualified religious or disability-related objection. And I will now turn over to Bill to talk about travel restrictions.
Hey, Lynn, thanks so much. All right, Dave, can we please go to the next slide? So New York used to have a restriction for anyone arriving in the state that would require the traveler to fill out a traveler health form, just discussing generally where they had been, any possible exposure. However, that restriction was lifted on June 25th, 2021, and further, on June 25th, New York lifted its travel advisory. Some of you may have seen previously, there's a group of states in the Northeast where we're allowed to travel more freely, but now the vaccinations are increasing. Travel, especially domestic travel, is not as regulated, and there's very few restrictions across the U.S. actually at this point. So now New York has adopted the CDC's guidance regarding domestic and international travel. And of course, the CDC guidance differs depending upon whether the traveler is vaccinated or unvaccinated. Regarding domestic travel, the CDC recommends that you delay travel until fully vaccinated. Well, it doesn't come right out and say that you should not travel until fully vaccinated. It still requires masking up on public transit. While we're on planes, metros, buses, getting to and from airports, anything of that nature. However, it does make an exception for any outdoor form of transportation. So just thinking here in New York City, ferries and the like, or any top deck of a bus. So if you're outdoors, the masking requirements are not required. And further, there's still social distancing whenever you can, although we've seen that's increasingly difficult, especially on airplanes. It's just something to keep in the back of your mind. And then also, upon return from travel, travelers are asked to self-monitor for symptoms after return. However, unvaccinated individuals are asked to abide by stricter guidelines. This is getting tested before and after travel. So unvaccinated individuals should be tested 1 to 3 days before they travel and should not travel if they have a positive COVID test. And then also after returning from any domestic travel to get a test 3 to 5 days after they have returned from travel. And then further, unvaccinated individuals are asked to quarantine during that time. They're asked to quarantine for 7 days, and this is a self-quarantine. It's not a mandated quarantine, but they're asked to quarantine for 7 days after returning from domestic travel if they receive a test, and 10 days if they choose not to test after returning. And then further yet, any unvaccinated individual that does choose to engage in domestic travel is asked to avoid any contact with someone who could be at higher risk. If you look at the CDC website, this is immunocompromised people, people of advanced age, anyone that's at higher risk for serious complications from the COVID-19 vaccine. Unvaccinated individuals should avoid interacting with them for 14 days after returning from travel. Next slide, please. International travel is a little bit different because the CDC says that you should not travel unless you are fully vaccinated internationally. Now, many of the guidelines regarding domestic travel also apply to international travel. However, this is for both vaccinated and unvaccinated individuals. So with international travel, the CDC doesn't make the same distinction. And we think that's likely because, well, the US has made significant strides, and so have many other countries. There are still many places where vaccines are lagging, where they're just not available. When traveling internationally, you're still asked to mask, to social distance whenever possible. But also, for both vaccinated and unvaccinated individuals, the CDC recommends the testing 1 to 3 days before you plan to travel, and then testing again 3 to 5 days after you return from travel. That's regardless of vaccination status. Now, the big takeaway here is the mandatory testing requirement for returning to the U.S. So any person, U.S. citizen, non-U.S. citizen, trying to come into the U.S. must take a test and receive a negative COVID-19 test result from within 3 days before the departing flight. Now, the 3 days is meant to be a little more flexible to allow for different flight times. There are many states in the U.S., I'll use Hawaii as an example, that had a 72-hour guideline. So the CDC realizes that there's a little more flexibility here. But this is something that's important to remember. This has to be an antigen test or a viral test. So there are only specific tests that will be accepted. And when a traveler is boarding their return flight to the U.S., they will need to present either the proof of a negative COVID test taken within the past 3 days. And again, it's going to have to be one of those PCR or antigen tests. Or alternatively, provide documentation of recovery from COVID-19 in the past 3 months. And that's a bit more onerous. It would require a note from a doctor or a public health official attesting that the individual had COVID and now is not displaying symptoms and has recovered, coupled with a positive COVID-19 test result showing that the individual did test positive for COVID at one time. And I'll give a brief anecdote. My sister's boyfriend was recently in the Mediterranean and was told that he could test in Rome before returning to the U.S. and ended up getting stuck in Italy. I don't know if stuck's the right word. Maybe his vacation got extended because he couldn't get the test and present it, right at the Rome airport. So I would just stress this is a very much know before you go situation because you will not be allowed to board flights back to the U.S. unless you can provide that negative PCR antigen test or proof of recovery from COVID-19 in the past 3 months. If we could go to the next slide, please. Another area that we've seen for concern during COVID-19 has been reasonable accommodations. This could be both for disabilities, thank you, Dave, and for sincerely held religious beliefs. Now, Lynn did mention the Americans with Disabilities Act earlier, and of course, individuals with a disability can request a reasonable accommodation under the Americans with Disabilities Act. However, the New York State Human Rights Law is broader. And it protects more than just disability discrimination. This also includes religious discrimination and pregnancy discrimination within its ambit. So employees that either have a disability or have a sincerely held religious belief or are pregnant may request a reasonable accommodation. There's 2 areas that we think we'll see most frequently. This is the telework, continuing to have either a telework or a hybrid work environment. or with the mandatory vaccine requirements. Now, accommodations are not always required, but take that with a grain of salt, because the undue hardship that an employer has to prove before providing an accommodation, it's a high bar to clear. And further, before an employer can say this is an undue hardship and we can't accommodate an individual, they have to go through an interactive process to actually engage in a dialogue. And you really have to be creative and look at all avenues for different accommodations. Here we really just stress being flexible, and for many of the accommodations that you're going to get under COVID-19, particularly the new mandatory vaccine requirements that employers can require vaccines, you can still go through your existing ADA or New York State human rights law process for whether a reasonable accommodation should be provided in that situation. Now, the EEOC has provided some excellent guidance, and of course, while it's not exactly, it doesn't exactly apply to New York State human rights law, it is close, and it suggests a flexible approach. So we think that it provides some very useful points, particularly around the work from home as an accommodation. Now, as many of us move to remote work, there are some essential job functions that may have had to be waived. So when asked, the EEOC said that people do not need to be allowed to continue to work from home as a reasonable accommodation if there were essential job functions waived, because the point of a reasonable accommodation is to allow an employee with a disability, sincerely held religious belief, or other protected status to continue performing the essential functions of the job. But before just saying, no, you can't remote work, employers really should be flexible and be creative. What are some other reasonable accommodations that you could provide? Now here we're thinking, masking, social distancing at work, staggering work shifts. Can we, some of the more extreme items then would be, is there another role that the employee could perform? Maybe something that's not customer facing. So either they're at a lower risk or your customers are at a lower risk of exposure. Continuing to work from home, or even job protected leave. So those are some of to be flexible, in these processes. But any time there's a reasonable accommodation, it's an individual analysis, and these are very fact-specific scenarios. Dave, if we go to the next slide, please. And of course, this also applies to the mandatory vaccines. Employers can require employees to be vaccinated if the employees are going to physically enter the workplace. I believe our recommendation at this point, we say that you should strongly encourage vaccines, although we're a little worried about mandating them. It can create, not only an HR and of course this reasonable accommodation issue, but it can also create an employee relations issue between the company and the employee. So, of course, again, if there's employees who can't vaccinate for health reasons, because they're immunocompromised or they have a sincerely held religious belief against vaccinating, employers really just need to be flexible, like I said, and be creative in thinking of what different accommodations could we use. Again, can this person mask at work and just work in a more socially remote environment so they have less interactions with others, less risk of exposure, even though they're unvaccinated? Can we increase ventilation? What if they worked a different shift than usual? So, just try to really exhaust all possible avenues. Again, these are fact-specific situations, so anytime that you are approached with a possible reasonable accommodation request, as a threshold issue, you want to know, is this person, disabled, or are they simply afraid of COVID-19? Because, being afraid of the exposure to COVID-19, that's not a disability. And although you should approach that cautiously, from an employee relations perspective, you want to be flexible and try to accommodate the employee. That's not an ADA or a New York State human rights law issue. Whereas if there's any suggestion of a medical issue underlying why the person doesn't want to vaccinate, or perhaps a religious issue, then you start getting into the area of, okay, well, this person might be asking for reasonable accommodation, and we may need to provide one because of their sincerely held religious belief or medical issue. Again, there's no one size fits all, and just be very flexible and thinking about what accommodations could be available. Next slide, please. And with that, I'll hand it back to Lynn to talk about expense reimbursement.
Great. Okay, So expense reimbursement in a post-mandatory work-from-home world. So expense reimbursements are a state law issue. There are around 10 states in the country that generally require by law the reimbursement of business expenses that are incurred by an employee on behalf or to the benefit of their employer. And New York State is not one of those states. So instead, the law in New York only requires that employers abide by their own agreements with employees to provide benefits. So Section 198B of the New York State Labor Law governs benefits and wage supplements, and the State Department of Labor Wage and Hours Division offers additional guidance on what exactly this means. It's up there on the slide, but it's sort of small, so I'll read it. Here, their FAQ state, quote, payment for time not actually worked other than sick time is not required unless the employer has established a policy to grant such pay. When an employer does decide to create a benefit policy, that employer is free to impose any conditions they choose. Fringe benefits may include reimbursement of expenses. And then there's also a 2008 labor opinion letter that lays out this rule even more clearly. So in summing itself up, it states, while an employer is not required to provide benefits to employees, once it agrees to do so, it must abide by the terms of that agreement. Next slide, please. So New York expense reimbursement laws and the COVID impact. So whether employees are working from home or the office, existing expense reimbursement policies must continue to be followed. A lot of employers created or implemented existing policies to reimburse expenses such as Wi-Fi, office supplies, cell phone bills, printer ink, when employees were required to work from home due to mandatory orders related to COVID. But now, many employers are encouraging workers to return to the office, either permanently or according to some sort of hybrid schedule. And a lot of employers want to continue offering employees the option to work from home for health, safety, or other reasons, and we encourage employers to continue to do that if it works for their business. But these types of optional or voluntary work from home setups raise questions about expense reimbursement. So what happens if an employee chooses for their own convenience rather than any business-related purpose to continue working from home? Does an employer have to reimburse any expenses that were incurred at home if they're not benefiting in any way by allowing the continued work from home? So the answer is still that the employer's own policy still governs. If employees were told that $50 off of their cell phone bill would be reimbursed monthly, that must happen. And even if employees can now return to the office and use their office phone instead of their personal cell phone, which is already paid for, if that's the policy, that's the policy. And the concern for many employers is paying for the same business expenses twice. So another example, even if an employer is reimbursing employee home internet bills, they still have to pay for their own internet in the office. And this concern has some tension with the desire that a lot of employers have to keep allowing people to work from home voluntarily, even as the pandemic situation is improving for health, safety, employee morale, and other reasons. So we have some recommendations for employers in these situations to balance their reimbursement-related concerns. And these are on the next slide, please. So first, if no written policy is in place, employers should create one. And this policy should specify which expenses will be reimbursed. And it should also specify all of the terms of reimbursement. So this includes the amount of the reimbursement if it will be capped at a certain dollar amount, if certain expenses will be reimbursed only if the employee is working from home versus if they are only working from the office, and any other types of terms or conditions. It should also have clear instructions and deadlines for how employees should submit their requests for reimbursement. And it should also state how and when those reimbursements will be processed and then issued. So if a policy in existence does not specify these key terms and limits, an employer could be on the hook for things that it did not intend to pay for. So, for example, it might make sense to reimburse dinner for an employee who's working late in the office, but it might not make sense to the employer to pay for dinner if an employee is working late from their own house. But if the policy that's in place is a blanket policy, and does not speak to remote work versus in-office work, then the employer could be liable for both expenses anyways. So once there's a policy in existence, employers need to disseminate the policy, and this can be done in a number of ways. It could be in the handbook itself, added as an addendum, a standalone communication, post on a website. And if the new policy is superseding or amending a previous policy, this also needs to be made clear in whatever communication is used. Under New York state law, employers really have all the discretion to create reimbursement policies as they see fit, even if the policy is just that they won't reimburse anything. But the key here is that if there is a policy in place, it will govern no matter any other rapidly changing circumstances, including the ongoing pandemic. Next slide. Oh, all right. That's all the material we have for you. Thank you so much. Kim, I'll turn it back over to you for some Q&A.
Great, thanks. Great job, Lynn and Bill. So let's start with a few questions. I guess one statement that I'll just make is that I know there were some questions about if our advice and guidance was generally geared towards New York. And the answer is yes. Today our presentation is generally geared towards New York updates and recommendations. Some of the topics that we've discussed can definitely be applied nationwide, certain things like reasonable accommodations, some of the safety protocols, especially because New York has lifted a lot of its guidance and restrictions. But of course, a lot of the other areas that we discussed today are centered around New York updates. So I'm sorry if there was any confusion around that. But let's talk about some of the questions. I know one of the questions came in about whether it was permissible to require employees to answer yes or no to a question about vaccination. And I'll answer that just because I've recently been asked this by a client. And the answer is yes, it is permissible all over, in nationwide to ask that question. There are various states and certain executive orders that have said you can't ask those questions, but those do not apply to private employers. So if you are a private employer, you can ask that question. And you do not have to allow the option of I prefer not to answer. Bill, I'm going to ask a question that came up on travel to you. For the travel guidance and quarantine, are there essential worker exemptions to the guidance that you stated? If you happen to know.
Thanks, Kim. Yeah, no, that's a great question. And many of the states did have such requirements before, but the CDC exemptions do not allow an essential worker exemption from the testing requirement. Now, just to clarify, it's just a mandatory test within 3 days prior to returning to the U.S. The quarantine, the self-quarantine, that's all just guidance at this point. So, while I think it would be highly recommended, particularly for unvaccinated individuals, especially those returning from international travel, or if they've traveled domestically to a state, as we've seen, I'm just recalling some of the recent headlines that, we have states that are seeing an uptick in the viruses. Quarantine, a self-imposed quarantine might be a good idea. It's not required. But at this point, the only exemptions under the CDC testing requirement are for airline crew members, airlines or other aircraft personnel, federal law enforcement officials, Department of Defense personnel, and people that are qualify for a humanitarian exemption.
Okay, great. Also, Bill, some questions came in on the HERO Act. Is the purpose of the HERO Act plan, is that in case of another outbreak? Because we know that you talked about that you don't have to do anything right now, but be prepared.
Exactly, Kim. Yeah, another great question. But the purpose of pardon me. Sorry, phone call coming in. Yes, the HERO Act, particularly with its kind of forward-looking and if you will, a bit reactionary. Again, it's based on what we've learned about airborne infectious disease spread over the course of the last 18 months under this pandemic. So, what we're seeing there is, what happens is we see another resurgence over the winter. We saw that with last winter, and now we see the uptick with the Delta variant. or, as we keep hearing scientists say, knock on wood that it doesn't happen anytime soon, but that, this is not the last pandemic that we're going to see. So the New York HERO Act requirements are forward-looking towards the next pandemic. They're not necessarily something that, is for right here, right now. Again, just because the commissioner has said that at this point, COVID-19 in New York State, at least, is not highly contagious airborne infectious disease that poses a significant public health threat.
Great. Lynn, I'm going to direct the next question to you that came in. So we talked about the fact that a lot of the guidance in New York has been lifted. A question came in about, should health screening still be done? Or, are we recommended that, is the recommendation just that unvaccinated individuals should wear masks and socially distance? Or, what do you think about just in general health screening for everyone?
Sure. So the answer is both. We definitely continue to recommend screenings for all employees, regardless of vaccination status, because as we've come to learn, even vaccinated people can contract COVID. They can have symptoms, potentially transmit, and so it's covering the employer's back by asking these questions in case, worst case scenario, there ends up being a workplace outbreak. Where employers can sort of relax what they've been doing is whether or not they screen out vaccinated people. So our recommendation is that everybody is asked the same questions. Are you currently experiencing, or have you recently experienced any new or worsening COVID symptoms? Have you had contact in the past 10 days with someone who was confirmed to have COVID-19? Or have you tested positive through a diagnostic test yourself? So these are the questions that all employees should be asked, but it's up to the employer if they want to stop screening out vaccinated people just for having the contact. So the law no longer requires vaccinated people or people who tested positive and then recovered from COVID in the past 3 months to be screened out, and instead just recommends that they continue to watch for 14 days for any developing symptoms. And of course, employers should encourage employees to let them know if there's any sort of change to their screening answers.
Great. I wanted to, before I forget, I wanted to announce the CLE code. For those of you who want CLE credit, it is SS as in Seyfarth Shaw, and it is 2991. Again, SS like Seyfarth Shaw, 2991. And just to follow up on what you were just discussing, Lynn, what about temperature checks?
So temperature checks are allowed. I think the precaution here for employers would be in terms of reporting what comes with a temperature check. So again, we encourage employers to keep record of the screening itself so that it happened and that the person either passed the screening or didn't. So if there are temperature checks, the record of the screening would be, we took this person's temperature, they did not have a fever. The risk comes into play when you start reporting other types of medical or health information. For example, that a person had a specific temperature or anything like that.
Okay. Bill, I'm going to turn it over to you for a question. With regards to the joint labor management committees that you talked about, are employers required to form those committees, or are they just being told that they have to permit them?
Another good question. And at this point, the Act only requires that these committees be permitted. Furthermore, just reviewing the standard that has been put up on the New York State Department of Labor website and the model prevention plan that they have up on the website, it doesn't actually contain the word committee in it. So it doesn't even seem like employers are required to notify at this point. Again, there are some specific trainings that the Act says employees will be allowed to attend. And one of those trainings in particular is a training regarding how these committees will work. So, with the November 1st deadline being a few months away, we should expect to see some further guidance about how employees will be notified about these committees, but at this time, employers aren't required to form the committees themselves. Simply permit employees to form such committees.
Great, thanks. A question came in about whether we'll be distributing the recording of this, and we will send out the recording by email to those of you who attended, because I know there was some interest in that, as well as to those people who missed it. So I see that our time is up, and we really wanted to thank everyone here for attending and joining us for this great discussion today. And again, if you have any questions that weren't answered today, please feel free to reach out to any of the three of us. And thank you.
Thank you, everyone.
Thanks so much.